Thank you, Jessica. I'm happy to be here as always. We love working with migrant ed staff from the health side. Um, all right, I have a lot of slides. We're not going to go over all of them. It's really kind of a reference slide deck for you all to refer to later, because we're going to cover a lot of territory here. And I'm a very informal presenter. I'll monitor the chat as we go. So if you have comments you'd like to share or questions, feel free to add them in the chat. Okay. So I work at the National Center for Farm Worker Health. I was trained as an occupational epidemiologist. So I focus on workplace health and safety issues. And at the National Center for Farm Worker Health, we do a broad range of activities, all focused on improving the health and well-being of farm worker families. So we're kind of similar to IDRC in that we do a lot of capacity building around health topics with government agencies, with farm workers serving organizations, employers, and farm workers themselves. Jessica just had a reminder for folks to add your questions to the chat rather than raising your hand. All right, so we're going to cover several things in here. We're going to talk a little bit about animal production workers because they are the most at risk for H5N1. We'll talk about what's going on with bird flu. We're going to talk about our outreach safety guidelines regarding bird flu. And then we'll talk a little bit about what we're doing and some resources that you can use, and we'll have a time for Q&A at the end. All right. So animal production workers, this list here is who I'm talking about when I'm talking about animal production. So I'm wondering here, I put poultry in the chat. Can you give a thumbs up to that comment? Can people give thumbs up to it? Oh, maybe not. But you can put in the chat if you work with workers who work in poultry, who work with cattle, dairy or beef, hog or pig farm workers, sheep and goat range workers. There's a lot of those out west. And then animal aquaculture is also included in this industry, but they are not really at risk for H5N1. And then the other group, the last group, might be folks who work on horse breeding farms. All right, quite a few dairy and cattle. That's great. So feel free to add any points that I miss as we go. So our estimates, if you talk about animal production workers who are directly hired by the farmer or who are employed by a contractor hired by the farmer, we think there's about 813,000 of those workers nationally. And we think that most of them, over 100,000, are concentrated in Texas, followed by California, Wisconsin, Iowa, and Oklahoma. So animal production workers, just like crop production workers, they don't have a right to overtime wages. OSHA has very limited jurisdiction on animal production farms. They only have jurisdiction over 4% of meat, dairy, and poultry farms. And this is because of OSHA's budget rider, which is that OSHA doesn't have jurisdiction on farms if there are 10 or fewer employees. And then some of you may have seen this. We've found that there are many indigenous workers from pre-Columbian communities in Mexico and Guatemala working in agriculture in the US. However, it seems to be higher in animal production, especially in dairies. So there's a lot more language considerations to think about if you're working with animal production workers. All right, dairy workers. So dairy workers usually work 8 to 12 hours a day. Many dairy workers do work 7 days a week, but the most common structure seems to be 6 days on, 1 day off, although it can vary. And many of the folks that you see on a dairy farm will be milkers, feeders, inseminators. You also see vets and vet techs if you're on one of the more larger industrialized farms. And on many dairy farms, you'll also see quite a few visa workers. These can be TN visa workers who, this is a non-immigrant visa, just like H2A. They can come to the US for up to 3 years. And on dairies, they'll either be trained as agricultural engineers or veterinarians. but they might be doing a variety of tasks on the dairy. TN visa workers can only be from Canada or Mexico. The only TN visa workers I've ever seen on a farm are from Mexico. You can also find H2A workers on dairy farms if they are growing feed for the cattle. The dairy industry has been consolidating pretty fast. We've lost about half of our dairy farms in the last 20 years, and this has been happening kind of at a faster and faster rate. Milk production, though, has increased in the US, and that's just because the number of farms is smaller, but there's still just as many dairy cows in production. It is different, though, depending on where you are in the US. The smaller, more family-run dairy farms are typically concentrated in the Northeast. The Midwest is kind of a transition zone, so you might see a lot of small family farms in the Midwest, but you can also see the bigger industrialized farms. And then once you're in California, Washington, the majority of those farms are pretty large industrialized farms. Dairy is very geographically concentrated in this country. California and Wisconsin alone make a third of all our milk in this country, and 25% of dairy cows are in just 17 counties in the US. So very concentrated, and that's why we've seen very rapid spread in certain states. One quick note here. So I like to always point out the transporters in the dairy industry because they're really important from an infectious disease perspective. And a lot of people miss this group because they are on and off dairy farms all the time. They're very mobile. They can go from town to town or state to state, and they do generally work 80 to 100 hours a week. So these three groups, one is the silage harvesters, and they also transport the silage for the cows. Those workers are usually H2A workers from South Africa or Ukraine, sometimes other European countries, and sometimes from Mexico as well. You'll also see milk haulers, and they can do short haul or long haul. So short haul might just be in between towns or, you know, in a small region, whereas long haul, they're going across state lines. And those milk haulers are usually from Cuba, Puerto Rico, or Mexico. And last, you have the folks who move the live animals around. These are usually US-born transporters. And this, I won't play this video, but these are two 19-year-old South African silage harvesters I met, and they, in the video, they're talking about how they work 15 hours a day, 7 days a week. So dairy workers have a lot of risk already. We know about H5 and how cows are getting workers sick with H5N1, but this has been a problem in dairy for a while. For example, tuberculosis can go back and forth between humans and cows. And there's a number of other infectious diseases that dairy workers are exposed to, as well as injuries from working around machinery and animals. And respiratory issues in dairy and poultry is really common. So a lot of asthma, a lot of bronchitis, COPD, and that's just because of all the dust in those workplaces. Very briefly, there's a few reports about dairy workers. Migrant Justice in Vermont has done some work on this. Farm Worker Justice has done some work on this. This is a little bit of information we have about dairy workers from Weld County, Colorado, and Yakima County, Washington. And one interesting thing was that we found that 14% of those dairy workers had migrated for work in the last 12 months, which is about the same as NAWS crop workers. So that's moving for a week or more away from their home. And that was a little surprising to us. The other thing I'll mention here is that overcrowding was really common among these dairy workers. Shared transportation was also very common. and about a quarter had received a flu vaccine in the last 12 months, which is about the same as the general US population, but it's a little lower than crop workers. All right, now poultry, I saw quite a few folks who work with poultry workers. I'm going to skip. You don't see a lot of visa workers in the poultry production industry. There are three main groups of workers in this industry. So one is the folks who work on the farm year round, and they'll work with egg production or broiler production. This group, though, is pretty small. It usually doesn't take a lot of workers to do that kind of work. You'll also see chicken catchers who work with broilers, and chicken catchers are usually working for a contractor and they go from farm to farm. So once the chickens are ready to harvest, they'll come in at night when the chickens are more calm, grab the chickens and put them on a truck and take them to the meatpacking facility. And then last, the one we're most concerned about with H5N1 are the people working in chicken depopulation. And that's because the tactic of the USDA has been that if a poultry flock has bird flu, they put down the whole flock. So if you have 1 million chickens or turkeys or whatever on your farm, it takes a lot of workers to put down the entire flock. And this is where we're seeing poultry workers getting infected, is doing that activity. Poultry is kind of the opposite of dairy. We actually have more poultry farms than we did 30 years ago. But those producers have very high debt and usually a pretty low income on average. And poultry farms are very concentrated in the Southeast and the Upper South, so places like North Carolina, Arkansas, Texas, Mississippi, many of the places that people in our audience are from. All right, let's talk about bird flu. This is a broad overview, just in case you don't know a lot about the topic. H5N1 is a type of avian flu, and it was first identified about 30 years ago in China. And when it first emerged in birds, it led to infections and 6 human deaths. It kind of died down after that first initial outbreak, and then it reemerged in Asia a few years later. By 2005, so just about 10 years after it had emerged, it was showing up in wild birds all over Asia, Africa, the Middle East, and Europe. So it had spread really far in wild bird populations. We didn't have H5N1 here that we knew of in North America until the end of 2021. And it was detected first in Canada, and then a few months later, it showed up in the US and started impacting the poultry industry. So it's been ongoing in the US poultry industry for 3 years now. The first year it emerged in 2022, we had 1 human case in a poultry depopulation worker. And then, of course, last year is the year that it emerged in dairy cattle. So a quick note, before we do all the farm stuff, a quick note about H5N1 in wildlife, because that's how we think it's mostly spreading to all these different animals. H5N1 has been found in almost 500 different species of birds and at least 48 different types of mammals. Most of the mammals who get bird flu are carnivores, so they're getting it because they're eating an infected bird. So that's why we see it in a lot of things like foxes and tigers, but it has shown up in mammals and no one knows how or why, such as in dolphins. But for the most part, over the last, several years, it's been showing up because a mammal ate an infected bird. So in poultry here, like I mentioned, we first found it 3 years ago in US poultry. Since then, 159 million birds have either died or been put down due to avian influenza. And this is not wildlife, this is just poultry birds. And a lot of that has happened in the last couple of months. So that's why we're seeing the big increase in egg prices. It's just because so many birds have been put down, and it takes a chicken, about 6 months of time to go from chick to an egg layer. So the industry is starting to really feel the effects of this ongoing outbreak. It has been in poultry, it's been found in every state and Puerto Rico. And the mortality is usually very, very high for infected birds. So they usually get sick, and they usually get sick very quickly. And this is why eggs, you don't really have to worry so much about eggs being contaminated with H5N1, because as soon as a chicken gets sick, it's going to stop laying eggs. So the risk is pretty low. This is a map showing where the concentrations in terms of the number of flocks that have been infected over the last 3 years. And this is a map from the last 30 days. So Ohio is currently the epicenter for H5N1 in poultry. All right, now about cows. So cows are a new host for H5N1. They're also a surprising host because they're not carnivores, they're herbivores. So they're not really eating a lot of dead birds. It's unknown, but the thought is probably that wild birds contaminated the feed of dairy cattle in North Texas. And that was the initial spillover event. However, once it got into dairy cows in Texas, the virus adapted and was able to spread cow to cow. And this is mostly through the milk. The amount of virus in the milk of cows is very, very high. It's actually very low in their fecal matter, and it's a little bit in between with their nasal secretions. But because the viral load is so high in milk, that's what scientists think, that cows are passing it either in holding pens with each other or through the milking equipment that's not sterilized from cow to cow. So, someone's asking about symptoms of H5N1. We have a whole table for that. So this is a great illustration from a research paper showing some of the places where transmission can happen in a milk parlor. Obviously, for workers, what we're most worried about right here is they're right at eye level with the udder of the cow. A lot of times they will strip the udder before they put the milking machine on, and milk can splatter in their face that way. Or when they're taking the milk machine off, it can splatter. And then of course their hands can be contaminated, and if they touch their face, they can get infected that way. Jose is asking if the milk can be infected with the cows. Yes. So if the cow has H5N1, then the virus is definitely in the milk. Pasteurization will kill the virus, but if it's unpasteurized milk, that's the main way we think it's being transmitted, is through milk. Now, this is a map of human cases of H5N1. So this might be a little higher now, but when I made these slides last week, CDC had confirmed 68 cases of bird flu in humans, and we had 1 death last year, or maybe it was this year. 60% of those 68 cases were among dairy workers, 34% were among poultry depopulation workers, 6% were either due to owning a backyard flock of chickens or the exposure was unknown. There is another source that has the case number closer to 100, and that's because they include cases that were called probable by the state health department, but CDC couldn't confirm it. And they also include people who were found to have an H5N1 infection through antibody testing. So it was after they had already been exposed. They weren't tested positive when they were sick. It was later. So a note about this virus, it's an influenza A virus. That's just like the common types of seasonal flu that are going around now, those are mostly influenza A viruses. The difference here is that the ones we get all the time every year are already adapted for human-to-human transmission, whereas H5N1 is not yet adapted for human-to-human transmission. There's two words you might see in the news a lot that I think are good to understand. One is a clade and one is genotype. So the clade we have here going around is 2.3.4.4b, and a clade just refers to a group of viruses that have a common ancestor. It's not critical that you know that, I just wanted to define it. What is more important that you know is what a genotype is. So a genotype is a variation of a specific virus. Just like you can have all kinds of different pasta, you can have, spaghetti, fettuccine, penne. Those are variations of pasta. So genotypes are variations of this H5N1 virus. What we've had circulating in cows and has been the most common to date is the B3.13 genotype. And what we're seeing now, very recently, like in the last really few months, is a new genotype that we're more worried about, and it's the D1.1 genotype. So B3.13 is what's been going around in cattle, making people sick, but to our knowledge, no one has died from this genotype, which is good. D1.1, though, is a little different. So D1.1 is the main type now in wild birds and poultry in the US. We did see people get sick with this genotype in Washington State, I believe in Franklin County, in October of last year. They were infected. No one was hospitalized. They were all poultry depopulation workers. Another worker in Nevada very recently got sick with this genotype as well. They were not hospitalized either. So that's good. However, some of the hospitalizations we're starting to see seem to be all linked to D1.1. So Canada has had one human case of bird flu. That teenager, they don't know how she got sick. She had the D1.1 genotype and she was in the hospital for several months. In Louisiana, late last year and in January, a person who was exposed because they had backyard chickens, they got the D1.1 genotype. They were hospitalized and died. It was an older individual. And we've had 2 hospitalizations in the last week. It's not known yet what genotype it is, but they were both poultry exposures, and my bet would be that it's D1.1, but it's not quite certain yet. However, it is a little concerning that last year in the US we had 1 hospitalization in the entire year, and then now just in the last week or 2 we've had 2. So it could be an anomaly, it could be a pattern shift. We don't know yet, but it is something to keep an eye on. All right, so now we're going to move to talking a little bit more about prevention. These are the groups of workers who are most at risk. We know that animal production workers have been infected. We know that vets have been infected, veterinarians, and we know that backyard poultry flock owners have been infected. In theory, slaughterhouse workers and first responders, like people doing outreach on farms, could be infected, but that hasn't happened to date. This is the slide with signs and symptoms of H5 in humans, in cattle, and in poultry. And this is in English and Spanish. You can use it as a reference for you and for workers as well. In humans, the most common sign in the US has been red eyes. And I'll show you a picture of it in a moment. And then all the other symptoms just look a lot like normal flu symptoms. So cough, fever, fatigue, muscle aches, and things like that. In cows, it's more subtle, and it's in a way that's bad because it's harder for workers to notice, or a lot of times the cows have it seems like they're infected several days before they have symptoms. But in cows, it's mostly they don't want to eat or drink is the main thing with cows. And yeah, I see people wanting the signs and symptoms. So you'll have a copy of the slide deck, and then I'll link to our safety protocol, which also has this in a Word doc format. So this is an example of the red eyes. This is from a photo taken of a dairy worker in Texas that was confirmed to have H5N1. There's a couple of different theories about why that's happening, but the thing to know with workers, I think, is that if they're feeling bad and they have conjunctivitis and they work around animals, they should definitely get tested for bird flu. However, they could still have bird flu even if they don't have the red eyes. So it's not the only symptom or the most important. It's just a common one. The ways we think people are getting sick is being exposed to milk, unpasteurized milk in a variety of ways. For the poultry workers, it's probably breathing in the dust in the poultry litter. And then, of course, if they touch a contaminated surface and then touch their face or their mouth or something like that, they could become sick that way. For human-to-human transmission, I want to explain something here. So with infectious disease, there can be sustained human-to-human transmission and unsustained human-to-human transmission. So sustained transmission is, let's say I'm sick and I get my daughter sick in my house. And my daughter goes to school and she gets 5 kids at school sick. And those kids get their parents sick. If there's chains of transmission like that, that's when we know that it's sustained human-to-human transmission and there's a problem. Unsustained human-to-human transmission would be I'm sick, I get my daughter sick, and no one else. She doesn't get anyone else sick. So with bird flu in Asia, they have documented unsustained human-to-human transmission, which is where a really close contact of the person who is working with the sick animals they get someone else sick, but it doesn't go beyond that. That was about 20 years ago that we last documented that type of human-to-human transmission. So it's good for family members and outreach workers to be cautious, but it is quite unlikely at this point in time. So we'll talk about safety guidelines. I'm curious if people can put in the chat, is anyone doing on-farm outreach to animal production workers right now? Or are you only reaching workers like in the community or at housing?
I would think across the country we have people going to farms.
Okay. All right. Let me see. Or maybe Jessica, I don't know if it's easy for you to grab that link. If not, I can.
I'll grab it and put it in there.
Awesome. So this link has the list of symptoms, and it also has our suggested outreach safety guidelines. Okay, yeah, there's quite a few people going to farms. With poultry, they'll know quick if bird flu is on the farm, but with dairy, it doesn't have to be that way. And I'll tell you a little short story. So me and some of my coworkers were in Central California last August doing outreach and data collection with H2A guest workers. And we went to one dairy in Central California to pilot test a survey. One dairy. No bird flu had been detected in California dairies at that time. They didn't think there was any bird flu there. The one dairy we went to, the worker I talked to had every symptom of bird flu. And I said, how are the cows? And he said, well, they're not really eating or drinking and their milk production's down, but it's hot outside. So that could have been true. That could have been the case. But immediately I was pretty worried that we had stumbled on a farm with bird flu. And then like 10 days later is when they documented bird flu in that county that we were in. So if you're going to to farms, dairy farms or poultry farms, you should exercise a lot of caution, especially if workers have any of these symptoms or if the cows aren't doing well. Thank you, Jessica. So there's a few guidelines for on-farm outreach, and the guidelines are much less intense for off-farm outreach. And they're really basically the same. If you're going onto a farm, the guidelines for you as an outreach worker are the same as for the farm workers pretty much. So it's recommended that you use an N95. Actually, let me skip ahead. So this is the PPE that's recommended. It's, coveralls, apron, N95, goggles, some type of head cover, gloves, and rubber boots. So it's a lot. It's a lot if you're going to be on the farm and anywhere near animals. There's a link to a video in here about how to properly put on and take off the PPE. You need to do it in a certain order because otherwise you could contaminate yourself accidentally if you take it off in the incorrect order. If you're going to be on the farm, but not anywhere near animals, not in buildings with animals, then we recommend that you use the N95, respirator, gloves, and boots. You don't have to do all the other stuff, but you would definitely still want to use an N95. A quick note, not right now, people who are in negative 19 degrees, but later on this year, or if you're in a southern state, heat can be a really big issue if you're using all this PPE. And so for the workers and for you and your coworkers, it's really good to participate in a heat safety training before doing outreach. You want to drink plenty of water and electrolytes, and you need to take breaks pretty often and take off all of the PPE, especially if it's hot, like over 85, 90 degrees. And then you'd want to have a buddy system. So we always recommend doing outreach in pairs. And if you're using PPE, it's really good that your coworker could recognize signs and symptoms of heat-related illness in you and help you get help if you needed it. Another important thing, and this is the same actually for community outreach too, if you have any open wounds, any scratches or anything, you would want to cover that with a waterproof bandage before you do outreach. Keep your belongings in your vehicle, because if you bring it onto the farm and set it down somewhere, that object could become contaminated if H5N1 is on the farm. Just like during COVID, you want to avoid touching your mouth, nose, or face, or possibly your phone as well. And then practice, good hand hygiene by washing your hands before and after you visit, right during any breaks or before eating. You want to definitely wash your hands if you've had any contact with livestock or the milk or anything like that. And then after contact with people who have signs and symptoms of flu, and you always wash your hands after removing your PPE. So again, here, this is a link to the sequence. I'm not going to go over it in detail because you have to have it on hand anyways. You have to do it a bunch of times before you memorize it, but you want to follow the guidance in the order of which to take things off. If you're not throwing it away on the farm, if it's something you need to throw away, you can bring a trash bag in your car and put it in there. And then same thing, if it's a reusable item, you would need to put it in a trash bag until you can clean and disinfect that item. So like rubber boots or something like that. And boots especially, you would want to wipe down that footwear with like a Lysol wipe or something before you get into your car. Hand sanitizer does help. Yep, you can use hand sanitizer. It's preferred to wash your hands with soap and water, but you could use hand sanitizer in a pinch. We also recommend parking your car away from the farm property, or at least if they have a line of biosecurity, before that line, because you don't want to be tracking stuff on your vehicle from farm to farm, which the USDA does think that might be happening, and that might be a way it's being transmitted from herd to herd. So be careful where you park your car. We also recommend that you get vaccinated for normal seasonal flu. The seasonal flu vaccine does not protect you from H5N1 infection, but it can do two things. There is some evidence that if you have the seasonal flu vaccine and you got infected with H5N1, it could potentially lessen the severity of an H5N1 infection. And it can also reduce the risk that your immune system is having to, fight off multiple types of flu virus at the same time. If you are on a farm with animals that have H5N1 or have symptoms, or you're around people that have symptoms of H5N1, you want to monitor your own self for symptoms for 10 days after that occurred. If you become sick during those 10 days, you would want to kick in your COVID protocols, basically. So isolate yourself. You'd want to tell your supervisor and coworkers that you are with, and then get instructions for seeking medical care. We actually, quick note, so H5N1, there's no rapid test yet. There is a point of care test that can be done in about 15 minutes for flu. So this is what you'll see a lot of times with healthcare providers. If someone was exposed to H5N1, they'll test them for flu. If that's positive, they'll collect a sample, often from your eye and your nose, and then send it to a lab. So we can only test for H5N1 right now in a laboratory. All right. So if you're just going to housing and community sites, the thing here is that PPE really isn't necessary. Of course, some people do choose to, use a surgical mask or N95 if they're doing outreach. Regular flu is really high right now too. So you can do that. We're not saying that you have to do that, but you can certainly do it if you choose to. What we do recommend is that you keep N95 respirators handy in your car when you're doing outreach in case you meet a worker who has symptoms. And then a lot of these same items about hand hygiene, getting vaccinated for the flu, etc. So what do you do if you're out in the community and you meet a dairy worker or a poultry worker who has symptoms? If you just run into them in normal outreach, we would recommend that you put on an N95 respirator and give one to the worker and ask them to put on the respirator as well. You would want to wash your hands really well, and then again, monitor yourself. The likelihood of them infecting you if they did have H5N1 is very low, but we think this is a good cautionary guideline. If you are in contact already with a worker who has symptoms, we really would strongly recommend that you speak with them not in person, so by phone or a video call. If you need to meet with them in person, we would recommend that you speak with them outdoors if possible. And again, use an N95, ask the worker to use an N95, use gloves, and if the worker won't use a mask, then using goggles would be wise. All right. I know there was a question here. Raquel had a question. So, there are 2 young children of a family living in rooms attached to a barn who have not been eating well. They are moving to a new house, so will they recover or should they be tested? So Raquel, if you could put in the chat, does that family have flu symptoms like fever, cough, body aches? I'll see what you say about that. So a little bit on our response and what we've been doing, and we'd be happy to collaborate, and I'm happy to connect offline with folks as well. We've had a 5-year project so far with CDC to address infectious disease issues among farm worker communities. So we've done work on COVID, on seasonal flu, on Mpox, sexually transmitted diseases, and vector-borne diseases. So we had this nice model already built, and now we've been looking at H5N1 through this partnership with the CDC. And this webpage kind of outlines all the main components of that work. But overall, really we have a pretty simple approach, and that's to think nationally about issues that impact farm workers, but act locally. No farm worker community is the same as the next one. Everybody has unique circumstances. So a lot of our work just focuses on making sure that people have the tools they need to come up with solutions that work for their communities. Our kind of main strategies are local farm worker outreach and training. We do a lot of health education materials in partnership with dairy workers and with crop workers. We do a lot of trainings like this and data collection. We're working on starting surveys with 800 dairy workers here in a couple of weeks. And these are our partners. So we have 42 or 43 partners who are doing infectious disease outreach and education to workers. And I'll show you the map. So 22 organizations are doing H5N1 outreach to animal production workers, including a migrant education program in Colorado. So the yellow counties are doing COVID and flu outreach to all types of farm workers. The blue counties are doing H5 outreach to animal production workers, and the green counties are doing both. And our partners are in about 21% of US counties. And I know there's quite a few questions. I'll answer them in a moment. A few tools that exist. If you haven't already signed up, we have a farm labor data dashboard. This link, I think you have to email me because I think we took this down because of concerns about some recent news events. So we can still give this access to the dashboard to migrant ed staff. I'll put my email in the chat later and you can email me if you need access. But this will give you the estimated numbers of animal production workers in states and counties. We also have a map, so we don't have it drilled down in our dashboard, dairy, poultry, etc. And actually, there's not very good data about the number of dairy workers or poultry workers. So what we did is we estimated the number of dairy workers based on the number of dairy cows in every county. And this map is available for anyone to use. So you can get an idea of how many dairy workers might be in your county. And then it also has locations of dairy farms and dairy processing sites. We have health education materials, including a flip chart or rotafolio about H5N1, and that is really targeted for dairy workers. It could be adapted for poultry, but it's quite focused on dairy workers and their risk of exposure through milk. But we have more general resources as well, such as flyers and radio PSAs in a number of different languages that dairy workers commonly speak. Thank you, Jessica, for all the links. Here's some more links that are useful. And oh, I wanted to add one thing. So free PPE. Dairy workers and dairy farmers can get free PPE 2 different ways. So if I'm a dairy farmer and I buy PPE from my workers, the USDA will reimburse me. And all the information about that is just you can Google USDA H5N1. It'll come right up. The other way that's a little harder to track down is some of the states with infected dairy herds, their health departments have PPE that they're giving out to workers. I don't know if it's been distributed to the newer states like Nevada and Arizona, but the ones last year all have PPE to give out. However, we have heard of some issues with that. health departments running out of PPE or just some access issues. So I would be curious to hear about that from folks if people have tried to get the free PPE and what they've done. And then some of our partners in Colorado actually worked with not a farm worker organization, they're like a Latino rights organization, and that organization fundraised to buy the more expensive forms of PPE for workers, so like the rubber boots and coveralls and things like that. So they did a fundraiser and did quite well to protect workers that way. So, all right, this is my email. I know there are quite a few questions, so I will go up and look at these. I did see Raquel, your comment about the children and failure to thrive. I mean, it sounds like they do need to see a doctor. Hopefully there's a health center in your area. If there's not, please shoot me an email and I'd be happy to help connect you to something for those folks. Because it might be something more than H5N1. Wilson asked, are there any disease issues among vegetable and fruit farm workers? There are. Respiratory disease can also be an issue with crop workers, especially if they have shared transportation or shared housing. Foodborne illnesses can also come up with crop production workers. And more broadly with farm workers, I'm worried about tuberculosis. Lots of people come from countries where tuberculosis can be more common, and most people, even H2A workers, are not screened for tuberculosis when they enter the country. So that can be a concern. And I will say, if you work with crop workers who are near dairies or poultry farms, I've talked to partners who are worried about them because they're finding the crop workers in some places are finding dead cats or dead birds on the farm, and they're having to dispose of the carcasses. So those workers, if they're disposing of any animal carcass and we don't know why the animal died, they should be cautious, use gloves, use an N95, etc. All right, so Maria asks, can people get H5N1 from eating meat and drinking milk? Yes, but with a caveat. So milk, if it's raw milk, if it's not pasteurized, that is very risky. They could get H5N1 that way. If the meat is undercooked, in theory, they could get it that way. I don't think that's happened, but it's possible. If the meat is cooked and the milk is pasteurized, the FDA has been doing a lot of research about this. It doesn't seem like people can get it that way. But again, if it's raw milk or raw meat, that would be a concern. Are beef cattle at risk of infection? So I'm glad you asked about this. No one is doing surveillance. There's no surveillance going on with beef cattle. Vets have brought this up. It's kind of an issue. The main issue is that cows don't have a lot of symptoms outside of the reduced milk production. So, especially in cattle farming, you just may not notice if their appetite drops off for a day or two. So, we don't really know if it's circulating in beef cattle or not, but they certainly are potentially at risk of infection. We just don't know the scope of it. Francis says we have a cattle farm close by and they're no longer allowing visitors or non-staff to the cattle farm. Yep, that's happening in a lot of places and I can't blame them. They really need to think about biosecurity. I don't think it's a bad practice. Of course, you still want to be able to access the workers and their families. So, if you have a relationship with that employer, I would recommend to see if there's any way you can reach those workers that won't cross their biosecurity lines, or try to reach the workers at a community site like a grocery store. Have CDC cuts impacted this work? Not yet, but they just fired a bunch of staff, so I anticipate it would in some way, but but that was very recent. So can we realistically assume that it's now human to human transmission, especially since we won't receive the support structurally or federally to do actual tracing? I don't think so. We would be seeing lots and lots and lots of cases if it was human to human, in a sustained way, even with bad surveillance. We would be seeing it a lot. I think the bigger concern epidemiologists have is that we we won't catch like the first time or two it's human to human with bad surveillance, and then it could get out of hand. Um, that's the bigger concern with poor surveillance. So I don't think that's happened unless it's happening like right now as we speak. Um, I don't think we have to make that assumption just yet. And then Monica also asked, how can actual PPE be offered to workers beyond surgical masks and more N95s, glasses, gloves, etc.? So Monica, it sounds like you're talking about like the boots and items like that. I mean, this really the employer should be purchasing this for their employees. But we all know some will, some won't. And so again, I think sometimes we have to get creative working with maybe faith-based organizations or industry associations can be a good partner in this too. Even if there's an employer that doesn't necessarily want to collaborate or isn't providing PPE, a lot of times the Dairymen's Association in the state can be a good partner there, or the Ag Extension offices. All right. Ruben said some state departments of ag have free PPE. That's great to hear. Wendy noted that Kansas has a tuberculosis outbreak currently. Yes. Yes, they do. And I think we'll be finding more and more now that it's on people's radar. Um, all right. Eric has a question. Can workers contract the virus from handling raw chicken in processing plants? In theory, they could. Again, I don't think it's so likely. They're not putting, so when the depopulation workers go in to put down the whole flock, they're composting those carcasses. They don't go into the food supply. So you would have to have like an unlikely scenario of birds getting sick and it flying under everybody's radar and those still being sold to the processor. It's not likely that that would happen. It could, but it's not likely. The bigger concern with slaughterhouse workers is folks who are processing cows, because the disease is not severe in cows and they are infected cows do get into the food supply, the meat supply. So that's the concern there. If they're processing the cow and they're working with the udder or something like that, is the workers who people think are most at risk in a slaughterhouse. So I think this answers Wilson's question as well about can it possibly be found in poultry plants? Again, unlikely. It could happen, I suppose, but they should already be using masks and gloves and things like that because there are other health concerns. But I think the likelihood of being exposed to H5N1 is pretty low in a meat packing house. There's an evaluation link in case you didn't see it. Santa has a great question about how often does FDA check farms? That is a question I do not know the answer to, but if you email me, I'd be happy to ask that and follow up. All right. I think that's about it. There's another question. Is there infectious disease issues happening with catfish farm workers? That is a good question. I am not sure about that specific industry, but could also look into it if you would like to email me. Eric has a great question. Have any cases been found in pigs? One in the US, one in the state of Oregon. And it was a backyard farm situation. It wasn't a commercial farm. All right. I think I got to everybody's questions. This was great. You guys had wonderful questions. I appreciate it. And thank you, Jessica, for hosting.
If I can use my unmute button. No, thank you. This has been super helpful. I feel like you're very easy to listen to, and I feel like I learned just I really appreciate your time, and we appreciate the good work that you guys do. So I will stop recording right now.